This space, name this space. Central canal. Okay? This table. Name this structure, and it also goes posteriorly. What kind of connoisseur?
Spinal.
Not spinal connoisseur? What color is it?
Gray.
Gray. Gray connoisseur. Okay, now you do have an anterior and a posterior. Let's see if we can tell anterior and posterior on our spinal cord right now. Let's look at this feature and compare it to this feature. Okay, so this table over here is going to tell me you're going to name that one.
Posterior median sulcus.
Posterior median sulcus. Okay.
Point to it again. Posterior median sulcus.
Posterior median sulcus coming all the way out to the surface of the cord. So that means that, actually let's stay here, that means that this structure is called what?
Posterior white column.
Shelby got it? Posterior white column on one side and on the other side, coming up to the surface out here. Okay. So let's come over here and let's let that back table name this shape. Posterior gray horn, and assign a function to it. Here's your choices: somatic, sensory, visceral, sensory, somatic, motor, visceral, motor. That table.
Sensory.
It's sensory. Help Amanda out. Kathleen, Chris, Matthew, Gina. Somatic, sensory, or visceral, sensory? Both. Both. Okay? So both of the sensory branches, both from our visceral organs, so visceral pain and fullness, and from our somatic body region, touch, temperature, pressure.
That's the
Dorsal gray horn. Right?
Wait, dorsal or? Oh, yes.
Dorsal is the same as posterior.
And it's sensory and motor, you said, right?
No.
What do you say?
sensory.
Front seat is motor, back seat is sensory. This is the back seat of the spinal cord. We're in the posterior or dorsal gray horn, so it is visceral and somatic sensory. Go back and look at those images in your chapter that I taught you from. They show that both map out there. If we come to the other side of the cord, here's our central, our gray connoisseurs and our central canal. By the way, what cell type lines the central canal? This table. It is a neuroglial cell. Ependymal or ependymal. Yeah, I'm from Minnesota. Ependymal. I never know which way or the accent.
I'm glad it's written.
Yeah. So name this feature, this table.
Anterior median fissure.
Anterior median fissure. Okay, AMF. And now that we know we're on the anterior side of the cord, go ahead and name this structure, this table.
Anterior white column.
Anterior white column. Do you agree, Gretchen and Mark and
Yes.
Terry and Joni? Anterior white column. So we're going to slide over now to the gray matter. And you guys name this gray matter.
Anterior gray horn.
Anterior gray horn. Now we can see some large cell bodies here. I don't know if this is a cell body or plaque, alpha tau plaque, but there are large cell bodies here. Can you guys assign the function? What kind of cell bodies are they? Motor, somatic or visceral? Somatic motor. Is Carrie right? Somatic motor neurons, somatic motor control from this ventral or anterior gray horn. Anterior front, driving the car, motor. Okay. Let's follow the side of that gray horn up. And before we get up to dorsal gray horn, and a little bit before we get midway, see this bulge? See how it comes out laterally? A lot farther than if you keep going up. Lateral gray horn, I heard it over here. And we have some large cell bodies here. Can that back table tell us what kind of neurons these cell bodies belong to functionally? Visceral motor, Kathleen hit it, okay? Visceral motor neurons for visceral motor control. We're going to be talking more about this. We're going to be associating this with only one branch of the autonomic nervous system. So on Tuesday, if you don't read ahead, we'll find out if it's sympathetic nervous system or parasympathetic. Okay? So that's the lateral gray column. We go out to the edge of the cord, and what's the white matter called over here? Lateral white column. Now I won't be asking you to name white matter versus gray matter on the practicum. Okay? So you'll always have to tell me the more specific white column name. Okay?
Point to it again.
So if I point to this and say name the structure, and you say white matter, you're only going to get partial credit. The name of this structure is the lateral white column. This is the lowest magnification I can portray this slide at, so we can't see it all at once. So I will orient you by starting out with about this image. Okay? And the last thing is what attaches to the cord. Now I'm not having you name the meninges on the cross section because they get all moved around as an artifact of the slide preparation. So we're not naming meninges as I ask this question, but in blue this is one of them. Okay? We're looking instead at this larger structure which is either going in or out of this posterior gray horn. And that structure is being pulled alongside the cord and is going to end up in this swelling. Okay? So the back table over there, and there's artifacts here. It's been busted up a bit. Name this structure, back table. Dorsal root. It's the dorsal root of the spinal nerve. Okay? Give me its function. Is it mixed fiber type, sensory only, or motor only? It's sensory only. It's a root. Only one type of fiber. So we follow it, and it's gotten busted up there again, but it leads right to this swelling. What do we call it? It's a ganglion. Is it an autonomic ganglion, or does it have a name? Dorsal root ganglion. Okay? So we have satellite cells here as the glial cells of support, but what is the functional type of neuron here, this table?
Somatic sensory neurons.
Somatic sensory neurons that are unipolar or pseudo-unipolar in structure. Okay? So we're doing a lot of review beyond the scope of Tuesday's test up to the scope of lecture content on the exam. You guys okay? So we're about done. The ventral root does not show well. This is the ventral root coming in. It merges with the dorsal root just distal, just beyond the dorsal root ganglion. And if we try to follow this over to the cord, you see it got disrupted. So I don't think I have a slide that shows you the ventral or anterior root coming off that anterior cord. So I typically don't ask that one on this test. Okay? So that is the spinal cord slide. It looks just like the spinal cord model. You have images of it on PAL as well. It was brought to my attention that the PAL CD, I can test from it if I just use my laser pointer instead of